Well, now to switch gears a little bit. October is Breast Cancer Awareness Month.
Yes, it is.
Can you talk a little bit about that?
Sure. Everybody in the world has breasts unless they've had it removed. So men have them, women have them. So it's very important to do self-breast exams, especially when you're a female. Men can get breast cancer. It actually can be more deadly because they have less tissue until it gets close to their chest. So men definitely do need to be cautious about breast cancer. I'm not sure of any events that are going on in particular about breast cancer awareness, but typically when I have women that come in for their routine pelvic exams, we always do breast exams. So it's not something just because of it being October, but something I do with them all the time.
When should women start checking their breast for breast cancer, and how exactly would a woman check their breast for a possible lump?
Women should be checking them every month. There have been some controversies over every month or not. Most of us pretty much stick with having women do it every month. Do not do it when you have your period because your breasts tend to be a little bit more lumpy and tender, and you may mistake a lump for something that's actually normal because of those hormonal changes. So I have people go ahead and do their breast exams pretty much after their period is over. And then what they do, there's a variety of things that you can do. You can do it laying down, you can do it in the shower. I actually brought the shower card that we give out to our patients. The easiest thing to do is do the breast exam in the shower. That's probably where most women have the most amount of privacy, especially on a campus like this where you don't really have your own rooms most of the time. So if you want, I can go ahead and demonstrate what to do. But what you want to do is you want to make sure that you put your hand behind your head, and then in a circular motion you can do the exam. Start in the armpit because you do have breast tissue all the way up in the armpit, and then go all the way around in a circle until you get to the nipple, and then with 2 fingers press on the nipple and make sure that there's no discharge coming from there, and then you go ahead and do the other side. You also could do it going up and down, kind of like you're mowing a lawn. I tend to when I examine my patients, I do the concentric circles just because I feel like you can make sure you get all the breast tissue. You want to feel soft and then you want to feel deep to make sure that you're getting masses that are kind of more superficial or ones that are more deep. You also want to look at the changes of the breast skin. Is it starting to dimple? Does it have kind of like an orange peel look to it? Is there any thing on the outside that you don't remember seeing before? Sometimes there's a breast cancer that's called inflammatory breast cancer that some people actually diagnose it as eczema because it had almost a look of eczema, which is a skin condition on the exterior part of the breast. You also want to make sure that the nipples haven't changed. Most nipples point out. Are they starting to point in? That would also be a sign that might indicate that they could have some cancer. So by looking and feeling, definitely, every month you can hopefully find something early enough, and that way we can send you off for ultrasound or mammography and get it tested and make sure there's no sort of cancer going on. And women in this age group definitely can get cancer. Obviously women that are older, more towards their 40s, are more likely to get breast cancer. The most common place that women can actually find a lump is going to be the upper outer port. So most women, when they have lumps, are going to be more over on this side. So make sure you do a good job in feeling that area. And every year, especially when you turn 18, you really should be going to a healthcare provider every year and getting a professional breast exam done. And then once you hit age 40, women will go routinely. They should go every year, I believe, or every 2 years for their mammography, depending on what their history is like. So you guys are young. We wouldn't typically do that.
Mind if I take a look?
Yeah, go right ahead.
How lovely illustrations. Yes.
So at age 20, people are going in for their first mammography.
40. Age 40. Now, if someone has a strong family history of breast cancer, they would go in at an earlier age for.
Because I have friends that have got it done.
Probably because their mom or sister or aunt have had breast cancer at a pretty early age.
And am I allowed to ask what the process is? Is it?
For a mammography, being that I'm not old enough yet, I have not gone for one, and I've actually never seen one done. It's not something that I did routinely in my clinics. But basically, according to what my mother says, is that you go on it's a flat plate, you lift up your breast one at a time, and then there's another plate that comes down and squishes, and then they just do sort of an x-ray.
I have to say that does not sound pleasant.
Most women will tell you it's not comfortable. Women who have denser breasts, some say that hurts more. Some women who have smaller breasts tell me that hurts more. So I guess it really depends on the person, the technician that's performing it, and how uncomfortable it is. But I can't imagine if someone's squeezing on your breast that it's very comfortable, period.
Right. And what about for men?
For men, you know, because I don't deal with a lot of men in that age, you know, it's more of the older men that would develop it. Those usually would go for ultrasounds or some sort of MRI scan.
Is the Wellness Center doing anything for Breast Awareness Month?
We are not. But if anybody has any ideas and wants to go ahead and put something together, I'd be sure to give people information to do something this month.
It's good. Well, it's time for us to take a short commercial break. Thank you, Rebecca, for coming on the show. It was really interesting talking to you. You shed light on many issues that we had questions about.
Well, great. Thank you so much for having me.
Thank you so much.